Hello, everyone, and welcome to another episode of Colorectal Cancer Canada's Tush Talks. Colorectal Cancer Canada is the nation's leading not for profit colorectal cancer patient group, and Tush Talks are our interview based webinar series where we provide information that is useful around colorectal cancer to patients, survivors, caregivers, family members, healthcare providers. If you want to know, we want to share. I'm your host, Carl Bindman, and I am joined today by one of our social workers at Colorectal Cancer Canada, Laurence Gauthier. Laurence and I are going to talk about some of the support opportunities and programs that we offer at Colorectal Cancer Canada. Laurence, how are you doing today?
Doing very good. Thank you, Carl, for receiving me today in this space. I'm very excited to have the opportunity to present our support services, the group, the individual support services options that caregivers and patients can access through the organization.
Yeah. Actually, before we move on, is it Gauthier Desrochers or Gauthier? What do you prefer?
Gauthier Desrochers usually, but
Okay.
yeah,
We'll
you can
add
go with
that.
Laurence too. That works.
So before we kind of get into things in detail, support is obviously a big concept, right? What is patient support to you?
Right. So with Colorectal Cancer Canada, we have several types of missions. So prevention, awareness, referral, research, advocacy, and support. So what we mean by support is just basically meeting the service users where they're at. So whether they need individual one-on-one support from a social worker. So we call the social workers in our team the patient support specialists. Or from our patient education and awareness specialist, which is Iris Carey. We just want to make sure that they have access to a space where they can process their experience of colorectal cancer, their experience of caregiving, just brainstorm together on important decisions that are going to have to be made, or just help them seek information, resources that are helpful and beneficial for their wellness and overall welfare.
Yeah, and this is it's separate from and external to the kind of like specific healthcare support that they get through the medical system.
Exactly. So we're not associated with a specific hospital or care center. We have a lot of partnerships, but the organization is really its own thing. So we noticed that a lot of the time patients will have support from their oncologist, their surgery team, family physician, but there can be either a lack of support regarding psychosocial related needs or mental health. And where support is available, sometimes we notice a lot of wait time in the just overall public system. So we just want to make sure that people can receive the support they need wherever they might be and also in good timing.
Yeah.
So, yeah.
So a good thing to do, you could say.
Absolutely.
On that, like, what are the ways that CCC provides support? Because I know we have like many programs that kind of tackle different stages of where people might be in their cancer journeys, what their relationship might be. Like you mentioned, caregivers and patients. So would you want to walk me through maybe kind of an overview of what it is we do, and we can get into detail
Yeah.
on some of them if you want.
Of course. Yeah. So when we talk about individual support, it's really service users centered. So whatever need or goal they want to aim at and address, we will make sure that the space is appropriate for them to be able to have those discussions with us one-on-one.
When you say
We also
service
have,
users, what does that
yes.
mean?
So I just use the term service users to include both patients and caregivers. We also offer support to family members, friends, so anyone that is significant in the life of someone who's been diagnosed with colorectal cancer, someone who has lost someone to the illness, or basically is impacted by this illness. We want to make sure that there is an avenue for them to seek support. So we basically include everyone that has a relationship to that type of cancer.
Thank
So
you for
colon
clarifying.
cancer and rectal. Yeah,
I'm sorry for interrupting your
you're all good.
yeah, please continue with the
Yeah. We also have support groups. So we have 5 ongoing groups at the moment. So we offer the National Support Group for French speakers. So this is a virtual meeting that takes place once a month. So it's every last Tuesday of the month at 7 p.m. Eastern Standard Time. We also offer, this is the only one that takes place in French. And we also have the National Support Group for patients who are age 50 years old and above. So this one we meet also remotely on Zoom on the second Tuesday of each month at 7 p.m. Eastern Standard. Also, there is the In-Treatment Support Group. This one is on the second Wednesday of each month at 1 p.m. The Early Age Onset Group. So when we say early age onset, it means any patient that has received their diagnosis before the age of 50. And so with this group, we meet on the first Tuesday of the month at 7 p.m. Eastern Standard. And finally, the Caregiver Support Group, which is on the first Wednesday of the month at 7 p.m.
So that's five support groups.
Exactly. Yeah. So depending on the language preference, depending on, what they are going through and their role, within the experience of colorectal cancer, just providing those interactive supportive space where they can share about strategies that they, have utilized that has been helpful, hardships that they've been facing, just to have also just a sense of community and to be able to connect with people who can understand their journey from a deeper level. So we've been noticing that these groups can be, place for really enriching discussions.
Yeah, and you host one of those? You host several?
At this time, I host the 5 support groups.
Oh, okay, great.
Yeah.
Yeah. And they're all free.
Yes, of course. So all the support services, all the referrals, basically all the services we offer for the service users, both patients and caregivers, family members, no fees are associated with those. So you can simply reach out to us by phone, by email, and we'll be glad to connect with you, assess what's most helpful, what's most beneficial for your personal situation, and there's never any cost associated.
That's good.
Yeah, for sure.
I thought you were going to say that a lot. That's good because it's all good stuff.
Yeah.
The next thing that I'm curious about is if you wanted to walk me through maybe what the individualized support looks like.
Mm-hmm.
That's
Yeah.
something that we do.
For sure. So it's definitely going to be different from person to person because we're really going to take the time to assess basically what the person needs, where they're at in their journey, and we are going to work with them really based on their own individual situation. So it's definitely up to you if you want to attend. Some people will decide to attend weekly, biweekly, monthly, just on punctual basis. If something comes up and you want to take a moment to discuss it with us, we'll be glad to offer this space. So there is myself and my colleague, Chelsea Butler, who is also a social worker with the organization. And we have our colleague, Iris Carey, who is our patient education and awareness specialist. So she has more expertise regarding the medical side of things, navigating the healthcare system, connecting with clinical trials navigator, things like this.
Yeah, the clinical trials navigator is something that I feel like is not obvious to folks that that's an option. I know a lot of kind of the work we do in other CCC contexts is like trying to encourage people to explore their options with like finding these things.
Yeah.
What other support things do you think are kind of like not obvious to people that we offer?
That we do offer, right? So besides individual support for psychosocial related needs or for information and besides from the group, we offer a variety of workshops, conferences, other support programs. I can go through a few of those. Yeah, so we are currently launching the Peer Support Network. So an initiative for either caregivers or patient to be able to connect with someone on a one-to-one base. So someone who is going through a similar journey, being able to address their own specific situation with someone who's not a professional in the healthcare system or in mental health, but just someone who has that lived experience. So we do offer short-term remote support with this initiative. We also do community connections on a bi-monthly basis. So we target topics that are of importance to our community. So we address things like self-advocacy, nutrition, and just offer basically a space. Sometimes we will have guest speakers who will be able to do a short presentation. And we have an interactive Q&A session right after, so people can really voice their concerns, their questions. And we have a moment to make this an informative and interactive moment. We also have community conferences. So we have our main community conference once a year. This year it's going to be on the 13th and on the 14th of May. So this is also something that we offer remotely. We'll have several professionals who will be there to share their expertise. Also people who are acting as ambassadors with us. So previous patients, caregivers, or people who are still going through treatment that can share about what it is for them to live with this illness and share helpful tips and information and resources.
Yeah, I think something that stands out to me is like the coherence or cohesion of how a lot of these support programs kind of like support each other or feed into each other. Like I can see how a patient would go to a patient support group and then get support from their peers and then realize they want to be helpful that way and then go become a peer support, learn how to do the peer support group. Like it's yeah, I think hearing it all laid out this way clarifies for me kind of like because inside of the organization there's a lot of people working on a lot of different things, but it's cool how it is so all encompassing in a way.
Yeah, a lot of our programs I think are very complementary, and I think we're very lucky because we have a very engaged community. And CCC, Colorectal Cancer Canada, started initially as a patient initiative, by patients for patients.
Yeah, our
so we really
president is
try
a
to
colorectal
keep
cancer survivor.
exactly. Barry is a survivor, absolutely. So we try to keep that spirit a little bit alive, trying to make the support services and the programs we offer as relevant as possible. And we're always receptive to, the service users' feedback. If there are needs that they, are seeing for themselves or for family members that they don't see a program or a specific service open for, we always want to hear from our community. So we make sure we're meeting them where they're at.
Yeah. Were there other sort of programs that you thought are important that people should know about before I interrupt?
You're all good. Yeah, so we have a few other things going on. So we've been launching this year the Connecting Through Cancer, the Family Toolbox educational module. So we have 5 modules that have been launched to address basically for people who have young children or even teenagers in their lives. So if you have to have a conversation about a diagnosis disclosure, if you are a parent or another family member and you want to understand the development stages for your child or for a child in your life. We have one about attachment theory, one about grief and loss, how to help your young family members cope. So we have developed this over the past year. We also have another initiative that has been launched by my colleague Chelsea, which is the Fear of Recurrence workshop. So this is based on acceptance commitment therapy, the acceptance commitment theory approach. So it is a 6-week workshop. So we meet weekly for 1 hour and a half. And so we really address basically the fears behind fear of recurrence for cancer, because we know that this is something that a lot of people can face, right? So once you're living without the disease or without evidence of the disease, there is sometimes that fear of, will I go through a recurrence? So we really try to have a space for people to address those fears and also develop effective coping strategies to address them.
Yeah, I think maybe 2 or 3 Tush Talks ago, actually, we did a Tush Talk on that topic.
Yeah,
which I guess, hey, Tush Talks, another support.
I was going to go there. Yeah, exactly. The Tush Talks are something that we definitely want to offer for the community. I think that's a great way for people to access some information on their own time, at their own pace. And it's all topics that are usually really relevant to what it is that, the community is facing. If you're, we have a lot of them. So if you're a little bit curious, if you want to touch base with one of our team members to target some Tush Talk that could be especially relevant in your situation, we're always glad to take the time to go through those.
And kind of on that, you were describing a lot of these materials, and those are all available. I think essentially all of them are available on our website.
Absolutely.
So, you don't need to reach out if you're like, I need this document and I know that it's the one that I need. You can go to the website, but
absolutely,
we're also happy to help and direct.
Exactly. They can go through those individually or connect with us to just have a better idea of what's available. Same goes for the toolkits. We have some about nutrition. We have some one that is called Never Too Young, so for early age onset patients, about fertility, caregiving, intimacy, pain management, side effects. We really cover a broad range of topics.
Yeah. And there are, my understanding is, because I don't develop these, but my understanding is that these are like, some of these documents are really long standing and have been around for a while, but we're always updating them with,
Exactly.
yeah.
Yeah. Yeah, we try to make them as relevant and up to date as possible, as inclusive as possible, and as accessible as possible. Yeah.
Yeah. Awesome. Shifting gears a little bit away from the incredible list of all the things that we do, I'm curious, just if you wanted to share a little bit about your own work and maybe why you started in social work, and what doing this kind of work means for the people who you work with, you know? That's kind of like four questions.
Absolutely.
I guess what I'm really asking is, what do you like about this work?
Yeah, I think I'm really fortunate to be able to connect with so many inspiring people. So, patients, caregivers, family members, survivors, I think we all have so much to learn from each other. And like we've mentioned at the beginning of this Tush Talk, sometimes there are some gaps in the, public system or just wait time. So I thought this was something that is really important to address. I think a lot of people who go through treatment and eventually stop either because they are done and are living without evidence of the disease or for other reasons. There is a little bit of a feeling of not being as supported as they were when they were actively going through treatments and having appointments. So we just want to make sure that there is continuity in the care that they can receive. So that was really important for me to be able to take part in that important initiative and that important organization.
Yeah.
Providing the support where either there is a lack of support or there is just not enough. We're aware that the demand continues to grow. There is more and more incidents of colorectal cancer. So we just want to meet the needs of the people, basically. And I think it's a really inspiring job that I'm lucky to get to do. Being in touch with all these families is something that I cherish very much and I appreciate.
What got you started in social work?
So I guess it's been just a natural flow of things for me. I started as I was younger, just doing volunteering jobs in hospital centers, in mental health specifically, with teenagers, with adults, with families, and it naturally progressed to this role that I have right now, where we get to do a little bit of everything, both about the healthcare, mental health, families, children, adults. Um, yeah.
Yeah, I resonate with what you said earlier about kind of getting to participate in like helping people navigate a challenging time in their
Hmm.
lives. I know for me, the thing that's really neat about working at Colorectal Cancer Canada is like, especially right now in the world of cancer research and
Hmm.
healthcare, like there are transformational changes happening in terms of like
Yeah.
how cancers are treated and like diagnosed, and that's stuff that I do not do, and I shouldn't do. I'm just a guy who talks, but like being able to watch and cheer on and then help people access all of those things
Yeah. Yeah.
it is like you said, a great privilege.
There's something powerful to it, right? I'm not an oncologist either or surgeon, nor should I be. But I'm really happy to take part in, making sure that people are accessing what they need and receiving the support that they deserve. So yeah, with the expertise that I have, right? So there's always everyone brings something different to the table. I think
Yeah.
that's yeah, really
um
empowering.
it is, yeah, it is, which is nice to feel in these times.
Hmm. Hmm.
Before we come to a close, because we're almost at our time, were there any things that you really wanted to talk about, or any questions that you would have wanted me to ask that I didn't?
Yeah, so I just want to thank everyone who's actively engaged in our community, especially our volunteers. Your presence and your involvement is so crucial and important to our existence. I want to thank also the people who are donating to our organization. So just want to take a moment to acknowledge everyone's involvement in this. and how important your contributions are. Also want to invite people who would like to join us for the Push for Your Tush event. So it is usually super fun. We have a run, we have a walk, we have animation, snacks. So this takes place on May 25th this year. So if you're feeling curious, you want to attend in person or remotely, feel free to visit our website for more details. Feel free to visit our social media as well if you want to keep in touch with the new initiative that we are launching. If you want to stay in touch with the research that is currently being developed, I think our social medias, our website are great places to be in the loop, as well as our newsletter. So
Yes.
basically, feel free to stay in touch.
Yeah,
However,
and
it feels right for you.
for those watching, you can find us at info@colorectalcancercanada.com, support@colorectalcancercanada.com, the website colorectalcancercanada.com, and on socials we're usually at colon Canada. I think it depends on which one specifically. Yeah, I guess actually before we go, I did have one question that I did want to ask that I didn't, which is, are there any support initiatives in the pipeline that are going to be releasing in the next, I don't know, call it 6 months, that you are excited about or want people to get ready for?
Absolutely. So one of the things I've briefly mentioned before is the peer support network. So this is something that we are relaunching. So it's going to grow and become more and more present in the next few months. We will also be starting new interventions for the early age onset population. So we're currently working with our team to develop specific interventions and approaches to bring the support to that specific age group and community. But I would say that, everyone is so different and their journey is always so different, that if you have something specific and you want to share about your own situation, I always invite people to reach out to us directly, so that we can keep them in the loop about what might be especially relevant for them.
Yeah, awesome. Well, Laurence, thank you so much for being here. This has been a lovely chat. And
Wonderful.
And to the folks at home, thank you also for being here. And usually I do my spiel about, where you can find us here, but I already did it. So I will just leave you with, have a great day.
Thank you. Have a good day.